Oh, I think it's key in telemedicine, and I think it would be even more challenging where you're not face to face with that patient, where you're not able to see some of those nonverbal cues that the patient may give you to, ensure that understanding. I mean, you might see a head nod, but a lot of patients are very agreeable. They're going to nod at anything you say. That's a polite thing to do, especially with someone who you feel is more powerful than you. And so you won't really know what they understand, or even if they are nodding their head, you're not really sure if they're nodding their head because they understand and get what you're saying, or just because they're being polite. And so I think that highlights these needs to use these sort of universal precautions, and just assume that anytime we communicate to a patient, a family, or a caregiver, and especially when we do that through telehealth and different forms of telemedicine, there's a risk for misunderstanding, and we need to just adopt some very easy strategies to minimize that risk, such as the teach back method. Sure, you got it right. Some of the best physicians, they do this very skillfully, and they'll say, well, I know you're going to go home and talk to your husband tonight and tell him, he's going to ask you what I told you. What are you going to tell him? And that gives you a chance to really listen to that patient and understand what they do understand. And then if there are any inaccuracies or misunderstandings, you get a chance to correct those before they leave the office. Instead of showing me the heart and the circulatory system and trying to tell me what's going on with plaque building up in my arteries, I could say, Stan, you have a house, don't you? Have you ever had a kitchen sink that had a clog in it? Well, that's what's going on here. Your arteries are kind of like the pipes, and you've got this stuff building up that we call plaque, and we're going to send something in there, since it's not that bad, maybe we're going to send a drug in. It's kind of like liquid Plumr. It goes through, and, even if I haven't had a clogged pipe, I've still seen that liquid Plumr commercial. I can visualize that. And so, just putting it in familiar terms that people can actually understand and process makes it very easy. Medicine. We really want people to focus on what that patient needs to know or needs to do, and what are the two or three most important things. And that's really limiting that information for patients and making it easier for them to digest and understand and then be able to act. In medicine, a lot of times we focus on the way we provide information is, and this is whether you're in medical school, you're reading a medical journal, article, or anything, you've got the pathophysiology up here, and the symptoms, and then what's going on, and the diagnosis, and then down at the very bottom is the treatment. And really, from the patient's perspective, what's most important is that treatment. And what we found is when physicians really say, okay, these are the two things I really need you to do today. I need you to start measuring your blood sugar. And what happens is they discuss that pathophysiology, and they say the reason that this happened is because we got this test back. It was for your HbA1c, or your blood sugar level, and that's why I need you to start taking this, because we found that you may be pre-diabetic, or something like that. And so as they kind of flip it and they focus on those two or three things they need to know, you get a lot of that other information, but it reinforces those two or three things so that the patient really gets a chance to get that.